Hi guys, Dr. H here, your source of advanced musculoskeletal care. And today I just want to go over some general guidelines for a healthy approach to exercise, particularly strength training. So let's talk about that. Alright, so again, a lot of what I do involves instructing people on how to do either certain exercises or just instructing people to get into a general exercise program to help with chronic musculoskeletal complaints. I'm a big fan of all exercise, including aerobic exercise and that kind of stuff. However, this video is going to be directed a little bit more toward like weight training and strength training because when it comes to chronic musculoskeletal complaints, that's usually the highest yield exercises. I'm not saying you can't get improvement by jogging, swimming, or whatever. I'm just saying that strengthening the body, working the joints, working natural movements usually has the most bang for your buck, if you will, in terms of helping out chronic musculoskeletal conditions. So I want to go over 6 guidelines for your approach to strength training and exercise, particularly in the setting of chronic musculoskeletal complaints. Number 1, it's not even really a guideline, it's just an overarching principle. All exercise is a marathon, not a sprint. What do I mean by that? My clinic is filled with people who are very sedentary during the week. And then the weekend comes and they feel like they need to make up for that. And so they go incredibly hard during the weekend. Bodies aren't always, particularly if they're a little older or if they have chronic musculoskeletal conditions, they're not meant to go from 0 to 60 like that. Going really, really hard after a whole week of being sedentary is sort of a recipe for injury. It is much better to work out, even if it has to be less intensely or not for as long as you like, during the week. And then you can work out even a little harder on the weekend if you want. Sure, that's fine. But I tell my patients this saying a lot. Anything that's worth doing is worth doing badly. Meaning, if you feel like you're really tired when you get home from work, you're not going to do any exercise, or if you went down and did it, it would be a terrible session, do it anyways. It's better to do exercise without maybe your maximum effort, or maybe even much effort at all, than to do no exercise and just be sedentary. So the first very specific guideline I want to give is, when possible, always do natural movements. You'll go to the gym and you'll see all these machines that can isolate a particular muscle through a particular, contraction, say like a bicep curl or something called a leg extension, where you sit on a machine and you extend your legs out and back. Or even if you're using free weights, people are just sitting there doing bicep curls or doing crunches, that kind of thing. I wouldn't consider these natural movements. These aren't typically movements you would do on a day-to-day basis. For example, a bicep curl you might think is a natural movement because you're picking things up, but how often are you really picking things up like a bicep curl? What your arms really are good for is picking things up and then stabilizing them. So an example of a natural movement would be picking up a weight and carrying it, or picking up a weight and moving around and trying to stabilize it to, up close to your body. Another great example is the squat. The squat is a fantastically natural movement. You go up and down. That's something you should be able to do in everyday life, compared to, say, that leg extension machine I was telling you about again. The reason for this is because you're training not just your muscles, but your nervous system. You're training movements. I always tell my patients, train movements, not muscles. Because your nervous system's job is to coordinate the firing of all these different muscles when you're trying to do a particular movement. And that coordination is better trained by doing that particular movement, not by doing isolated parts of that movement. So if you want to be able to function better in everyday life, you should be doing these more functional natural movement exercises. The other great thing of a natural movement exercise, it usually involves multiple joints, and so the load of that weight is being distributed over multiple joints. Again, take the squat, one of my favorite exercises. You're at least using your ankle, your knee, your hip, and if you're doing it correctly, your low back. And then your whole body is having to sort of balance that weight and stabilize across multiple joints. This is very synonymous with what you're doing in real life. So that's what I mean by doing natural movements. The next guideline, this is a very rough guideline, but some of my patients want to do these exercises for like 20 repetitions or 25 repetitions. And there's nothing necessarily wrong with that. Different repetition ranges have different benefits, pros and cons. But because I see a lot of overuse injury, I see a lot of tendinopathies, I do tend to recommend heavier weight, fewer repetitions. Again, I'm not saying you have to do that. I'm just saying, particularly if you're someone who has a history of tendinitis or tendinoses, maybe fewer repetitions, but a heavier weight to keep the intensity the same. So kind of going back to that last point, this is a different guideline though, but again, like doing natural movements, it's best, when possible, to use free weights over machines. Now, I know this is not always possible. You may be limited by the equipment available to you by either at your gym or wherever you're located. However, usually even gyms that are mostly machine heavy have some kind of free weight area. It's the same principle really as the natural movement thing. You're training your nervous system to do things you would do in real life, and in real life you don't usually have a machine restricting your pattern of movement. When you're using free weights, you're also training your nervous system to balance that weight in three-dimensional space. And that again will help when you're picking something up in real life and balancing in three-dimensional space. Again, the idea here, the overlapping idea here is that your exercise should kind of represent what you need to do in real life. So in the same vein of using free weights over machines, a lot of my patients will say, well, I'm scared to use free weights, I'm worried I'm going to do something wrong. You can just as likely do something wrong on a machine. In fact, machines are usually less able to be adjusted for your particular body and biomechanics. So if you have a little bit of, for example, increased curvature in your back or a little bit of hunching because you work on a computer all day, and you go to a bench press machine that's really meant to be done like this, but you're doing it like this, you're actually going to increase the risk of injuring your shoulder. With free weights, at least, you can adjust the free weight in three-dimensional space to make sure that it's appropriate for your body. Also, very importantly, it's best to warm up before doing an exercise. I see patients all the time who come in with back pain, and they say, well, doc, all I was doing was bending over to pick up a towel. It wasn't even anything heavy, and when I came back up, my back spasmed. And what that usually is like a neurological misfire. In other words, your brain tells your muscle to contract harder than it needed to contract to do that motion. It was an uncoordinated contraction, and now you have an injury or spasm. That can happen when you exercise too. And so it's best to prime your nervous system for the exercise you're about to do. So let's say you're about to do a squat with maybe holding weights. Do it first without holding weights. It won't be very challenging. It's not meant to be. It's just meant to tell your nervous system what it is you're about to do with heavier and heavier weights. This will help prevent you from doing things and having these uncoordinated movements that can lead to spasm. Warming up also helps physically warm up your muscles and makes them less likely to be injured. The final piece of advice is, I know a lot of people who like to do a lot of stretching before they exercise. Don't do that. If you want to stretch, and I have a whole video that I'll link up here about stretching and the details of that, but if you are going to stretch after you exercise, not before. A lot of studies have shown that stretching before exercise does nothing to help prevent injury. A lot of studies show that it will decrease your performance, and even a couple studies show it may increase your risk of injury, probably because it's decreasing your performance. So if you are going to stretch, do that afterwards, not before. Warm up before, stretch afterwards. All right, guys, I hope these guidelines kind of help make you feel a little bit more comfortable about doing some strength exercises, particularly if you have chronic musculoskeletal complaints. As always, if you have any concerns, feel free to find somebody who is a trainer or a musculoskeletal specialist, like a musculoskeletal physician or anybody like that. And until then, keep moving.